So hello everyone, this is Dr. Shubham, and today I'm going to demonstrate the right manner of taking the inhalers. So we know that many COPD patient and the asthma patients particularly, they are taking the inhalers very oftenly in their home, right? So how to take these inhalers in a right manner, that is also very important, because mostly these patients, some of these patients are coming up in the OPD, and whenever if you will ask them how they are taking their inhalers, so some of them, they are not taking their inhalers in the right manner, and that's why they are not getting the benefits of the inhaler and that medicine, right? So as a physician, we need to tell them the right manner of the inhalers as well. So today in this particular session I will be talking about the inhaler, that how we should take the inhaler in a right manner. So this is the inhaler particularly, right? Which you can see, the drug can be anything. It can be anticholinergic, it can be beta 2 agonist as well, like levosalbutamol. So but the thing is how to deliver it, right? So this is the inhaler, and here you can see that in this part basically you can see the number of doses also. This is showing 0, it means it is not having any dose. For this is just for the demonstration purpose. So that's how the inhaler looks like, isn't it? And that's how this is the medicine basically. So the inhaler should always be used with the spacer. So this is something which is called as spacer. This spacer, let me tell you basically. So this spacer is having this is the inhalational chamber. Okay, this is the inhalational chamber, this is the lock, this is the mouthpiece cap, and if you remove the cap, right, if you remove the cap, so this portion is the mouthpiece. Okay, so this is the spacer, and usually these inhalers should be taken with the spacers, right? So we'll fix the inhaler in the spacer like that. Okay, and then we shall deliver it. So let's start with the process, that how to do it. So let's say this is the inhaler in front of my in my hand. So basically, first of all, I should be shaking it well. So first of all, I should be shaking it well so that it is thoroughly mixed, right? Once you have shaked it well, then what you need to do is you need to put it into the spacer. You need to put it into the spacer, not directly into the mouth, put it into the spacer. After putting it into the spacer, okay, what you will do is you will remove the cap of the mouthpiece, right? And then what you will do is you will take a deep breath and then exhale it out. After exhale it out fully, then you will be putting this mouthpiece into your mouth and seal the lips around this mouthpiece, right? Like this, right? And then you will be delivering a dose like this, and you will be hearing a clicking sound like that. Okay, I hope you heard it in the video, right? Once you did that, you will be putting that in the mouth, like seal the lips around the mouthpiece, and once you did it, you will be taking a deep breath. Once you take it, then you need to hold your breath for at least 10 seconds. Okay, and if you can hold it more than 10 seconds, then it is well and good. But for at least 10 seconds, the person or patient should be holding his or her breath, right? And after holding it for 10 seconds, they can exhale, right? And that's how the inhaler is actually delivering the medication into the lungs, right? And that is the right manner of using the inhaler. So once again, I'm gonna demonstrate it. So first of all, I will be shaking the inhaler well. Then what I will do is I will insert the mouthpiece of the inhaler into the spacer. Once I do that, then I will be removing the cap of the mouthpiece, right? I will be taking the deep breath and then exhale. I will be putting this mouthpiece into my mouth and then delivering this drug. and that's how we should be taking the inhalers, right? So once again I'm repeating the step. First of all, you need to shake the inhaler well, then put it into the shaker, and then remove the mouthpiece of this particular spacer. This is not the shaker, spacer basically. And then seal the lips around this mouthpiece, deliver the medication, right? And then take the medicine thoroughly with the deep inspiration, and then hold your breath for 10 seconds, and then you can exhale it out, right? So this was the right manner of taking the meter dose inhaler, and meter dose inhaler should be taken with the spacer. I hope this video was helpful. Thank you for watching. Bye bye.